My qualifications are that I am a registered nurse with a doctorate of nursing practice. My education path involved 4 degrees. My first one was a Bachelor's of Science in Kinesiology from Penn State University. My second was a Bachelor's of Science in Nursing from Thomas Jefferson University. My third was a Master's of Science in Nursing with an emphasis in Community Systems Administrations from Thomas Jefferson University. My final one was a Doctorate of Nursing Practice with an emphasis in Nursing Education from Wilkes University. I worked as a floor nurse for 3.5 years in the acute care setting, working with traumatic brain injury patients, spinal cord patients, stroke patients, amputees, med-surg, and on a neurologic step-down unit. After that, I became a nursing professor in 2014, and I've been a nursing professor now for the past 10 years. I've worked at 4 different universities: Shawnee State University, Chamberlain University, Gannon University, and Thomas Jefferson University. I'm also a holistic wellness coach and a leadership coach, and I work with clients outside of the academic setting to help improve their outcomes and whatever goals they have in their life. In nursing school, you are in 3 different settings receiving your education. So you're in the classroom, which is considered the didactic setting. You're in the lab setting, which is a simulated hospital setting where you're learning how to take care of patients, but in a safe environment and with mannequins. And the final setting is in the clinical setting where you're actually caring for patients. So you're taking everything that you've learned from the classroom and the lab, and you're implementing it in the clinical setting with real people in a real hospital. Time management becomes an important aspect of nursing. Whether you're in a traditional program or a non-traditional accelerated program, time management will be a key to success. Acknowledging that, accepting that, and understanding that prior to you beginning your path in the nursing career as a nursing student is going to be essential for your success. Because outside of the classroom, we all know that there are things that exist, like personal relationships, your relationships with loved ones, with family members, if you have kids, if you have a significant other, if you have a job outside of school, your financial aspects that you have to take into consideration. Making sure you have a plan to handle all of those when you go into nursing school will be a great key to success. Some other factors that I think lead to success in the realm of nursing school is accountability. Instructors will give you all of the information that you need to be successful in the course. It's up to you to be accountable for the work and keep on asking why, to understand what is the importance of this work for my career in nursing. What is the importance for learning this skill and how will it be applied in nursing? Taking accountability for your education is a big key to success. 2 other factors that I think are keys to success: resiliency and resourcefulness. Like I said, there's other things outside of the classroom that you're going to have to manage along with your classroom duties and requirements. So ensuring that you are a resourceful person and you can figure out ways to get things done when maybe you are a little bit overwhelmed, and putting some things to the side to prioritize what's most important in your nursing education. And then being resilient, understanding that there may be some difficult times and figuring out a way that if you have that will, then there will be a way for you to be successful in that nursing course. My coaching style is a reflexive type of style, meaning I refrain from using you should statements and telling you what you need to do. What I like to do is develop a more individualized approach by getting to understand and know the student. What are your values? What are your needs? What type of learner are you? What type of environment do you thrive in? All of those are key factors that I want to understand and then help you in guiding you towards the school that will fit with all of those values that you've described to me. My greatest strengths is being an active listener, listening to understand, not listening to respond. I've had my own previous experiences that I've had to learn from. We can certainly use those anecdotally for reference when I'm working with a client. However, I want to listen to what you have going on, and I want to see that from a blank slate so that we can build a relationship together to help get you into the nursing school that you want so that you can have the career that you would like to have. I'm a first-generation college student, so no one in my family prior to me had gone to college. During the time of admissions, I did not know what I was doing. I was seeking guidance that did not exist in my internal family circle. I got a lot of assistance from counselors in high school, teachers in high school, but even then, I didn't know what the right questions were to ask. I did feel lost during that journey. It all ended up working out well for me. However, there are some things that I would have done a little bit differently that would have reduced my stress and that would have reduced any sort of anxiety that I had about the process. Now that I'm on the other side of higher education and working as a professional with 4 earned degrees, I want to help students that are navigating that process to ensure that they do not feel stressed, that they do not feel anxious, and they feel excited about their future that they're investing in